41. What is the priority action for a nurse when a 9-month-old infant with heart failure has poor feeding? Answer: notify the provider and monitor weight gain. Rationale: poor feeding indicates worsening heart failure, requiring evaluation, per AAP congenital heart disease guidelines. 42. What should the nurse do when a 5-year-old child with a fracture reports severe pain? Answer: administer prescribed analgesics and assess neurovascular status. Rationale: severe pain may indicate complications, requiring pain relief and assessment, per AAP fracture care guidelines. 43. What is the best action for a nurse when a 2-year-old child with diarrhea has a sunken fontanelle? Answer: initiate 4 fluids as prescribed and monitor electrolytes. Rationale: a sunken fontanelle indicates severe dehydration, requiring 4 fluids, per AAP gastroenteritis guidelines. 44. What should the nurse do to prepare a 10-year-old child for an MRI? Answer: explain the procedure and practice lying still. Rationale: explanation and practice reduce anxiety and ensure a successful scan, per pediatric nursing standards. 45. What is the priority action for a nurse when a 6-year-old child with meningitis has a stiff neck? Answer: notify the provider and prepare for a lumbar puncture. Rationale: nuchal rigidity indicates meningitis, requiring diagnostic confirmation, per AAP meningitis guidelines. 46. What should the nurse do when a 3-month-old infant is not gaining weight? Answer: assess feeding patterns and refer to a dietitian. Rationale: poor weight gain may indicate feeding issues, requiring specialist input, per AAP growth guidelines. 47. What is the best action for a nurse when a 12-year-old child with asthma uses an inhaler incorrectly? Answer: demonstrate proper technique and provide a spacer. Rationale: correct technique and spacers improve medication delivery, per NAPE guidelines. 48. What should the nurse do when a 4-year-old child is hospitalized and refuses to eat? Answer: offer familiar foods and involve parents in meals. Rationale: familiarity and parental involvement encourage eating, per pediatric nursing standards. 49. What is the priority action for a nurse when a 7-year-old child with a head injury has unequal pupils? Answer: notify the provider and prepare for a CT scan. Rationale: unequal pupils suggest brain injury, requiring urgent imaging, per AAP head injury guidelines. 50. What should the nurse do when a 1-year-old infant with a fever is irritable? Answer: administer acetaminophen and provide a quiet environment. Rationale: antipyretics reduce fever, and a quiet setting calms irritability, per AAP fever management guidelines. 51. What is the best action for a nurse when a 9-year-old child with cystic fibrosis has a productive cough? Answer: administer prescribed mucolytics and perform chest physiotherapy. Rationale: mucolytics and physiotherapy clear airway secretions, per Cystic Fibrosis Foundation guidelines. 52. What should the nurse do when a 2-year-old child pulls at their ear and cries? Answer: assess for otitis media and notify the provider. Rationale: ear pulling and crying suggest otitis media, requiring evaluation, per AAP otitis media guidelines. 53. What is the priority action for a nurse when a 5-year-old child with diabetes has a blood glucose of 50 milligrams per deciliter? Answer: administer a fast-acting carbohydrate and recheck glucose. Rationale: hypoglycemia requires immediate glucose correction to prevent seizures, per ADA guidelines. 54. What should the nurse do to promote play for a 4-year-old child in isolation? Answer: provide safe toys and engage in interactive play. Rationale: play supports development, and safe toys prevent infection, per pediatric nursing standards. 55. What is the best action for a nurse when a 6-month-old infant has a respiratory rate of 50 breaths per minute? Answer: notify the provider and assess for respiratory distress. Rationale: tachypnea may indicate hypoxia, requiring evaluation, per AAP vital signs guidelines. 56. What should the nurse do when a parent questions the safety of the HPV vaccine for a 12-year-old child? Answer: educate about vaccine benefits and provide CDC resources. Rationale, education addresses concerns, promoting adherence per CDC immunization guidelines. 57. What is the priority action for a nurse when a 3-year-old child with burns has poor urine output? Answer: notify the provider and assess for dehydration. Rationale, poor urine output indicates fluid loss, requiring urgent evaluation per AAP burn care guidelines. 58. What should the nurse do when a 10-year-old child with leukemia reports fatigue? Answer: assess for anemia and encourage rest periods. Rationale, fatigue may indicate anemia, requiring rest and evaluation per AAP oncology guidelines. 59. What is the best action for a nurse when a 2-year-old child with a fever is dehydrated? Answer: administer oral rehydration solution and monitor intake/output. Rationale, rehydration corrects fluid loss and monitoring tracks recovery per AAP fever management guidelines. 60. What should the nurse do to promote safety for a 5-year-old child with a bicycle injury? Answer: educate about helmet use and assess for concussion. Rationale, helmets prevent injuries and concussion assessment ensures safety per AAP injury prevention guidelines. 61. What is the priority action for a nurse when a 7-month-old infant with RSV has apnea? Answer: initiate resuscitation and notify the provider. Rationale, apnea is life-threatening, requiring immediate resuscitation per AAP RSV guidelines. 62. What should the nurse do when a 4-year-old child is afraid of N4 insertion? Answer: use a topical anesthetic and explain using a doll. Rationale, anesthetics reduce pain and explanations with dolls decrease fear per pediatric nursing standards. 63. What is the best action for a nurse when a 9-year-old child with sickle cell disease has a fever? Answer: notify the provider and obtain blood cultures. Rationale, fever may indicate infection, requiring urgent evaluation per AAP sickle cell guidelines. 64. What should the nurse do when a 1-year-old infant has a rash after a new food? Answer: assess for allergic reaction and notify the provider. Rationale, rashes may indicate food allergies, requiring evaluation per AAP allergy guidelines. 65. What is the priority action for a nurse when a 6-year-old child with a fracture has absent pulses distal to the injury? Answer: notify the provider and prepare for surgical intervention. Rationale, absent pulses suggest vascular compromise, requiring urgent surgery per AAP fracture care guidelines. 66. What should the nurse do to promote nutrition in a 6-month-old infant transitioning to solids? Answer: introduce single-ingredient foods and monitor for allergies. Rationale, single foods reduce allergy risk and monitoring ensures safety per AAP feeding guidelines. 67. What is the best action for a nurse when a 12-year-old child with asthma has a cough at night? Answer: assess for triggers and administer a controller medication. Rationale, nighttime cough suggests poor asthma control, requiring medication per NAPE guidelines. 68. What should the nurse do when a 3-year-old child is non-compliant with nebulizer treatments? Answer: use a playful approach and involve parents. Rationale, playful methods and parental involvement improve compliance per pediatric nursing standards. 69. What is the priority action for a nurse when a 5-year-old child with meningitis has a seizure? Answer: administer prescribed anticonvulsants and ensure airway patency. Rationale, seizures risk hypoxia, requiring immediate control per AAP meningitis guidelines. 70. What should the nurse do when a 2-year-old child has a temperature of 104 degrees Fahrenheit? Answer: administer acetaminophen and initiate cooling measures. Rationale, high fever risk seizures, requiring antipyretics and cooling per AAP fever management guidelines. 71. What is the best action for a nurse when a 10-year-old child with diabetes reports nausea? Answer: check blood glucose and assess for ketoacidosis. Rationale, nausea may indicate hyperglycemia or ketoacidosis, requiring evaluation per ADA guidelines. 72. What should the nurse do to promote safety for a 4-year-old child in a car? Answer: educate parents about forward-facing car seats with harnesses. Rationale: proper car seats reduce injury risk, per AAP safety guidelines. 73. What is the priority action for a nurse when a 6-month-old infant with heart failure has cyanosis? Answer: administer oxygen and notify the provider. Rationale: cyanosis indicates hypoxia, requiring oxygen and evaluation, per AAP congenital heart disease guidelines. 74. What should the nurse do when a 3-year-old child with a burn is crying uncontrollably? Answer: administer prescribed analgesics and provide comfort measures. Rationale: pain and fear cause distress, requiring analgesics and comfort, per AAP burn care guidelines. 75. What is the best action for a nurse when a 9-year-old child with leukemia has mouth sores? Answer: provide oral care with a soft toothbrush and rinse with saline. Rationale: gentle care prevents infection and promotes healing, per AAP oncology guidelines. 76. What should the nurse do when a 1-year-old infant is irritable during a diaper change? Answer: assess for diaper rash and apply a barrier cream. Rationale: irritability may indicate rash, requiring treatment, per AAP skin care guidelines. 77. What is the priority action for a nurse when a 5-year-old child with croup has a barking cough? Answer: administer nebulized epinephrine and monitor respiratory status. Rationale: barking cough indicates airway obstruction, requiring epinephrine, per AAP croup guidelines. 78. What should the nurse do to promote development in a 2-year-old child during hospitalization? Answer: encourage play with age-appropriate toys and involve parents. Rationale: play supports development, and parental involvement reduces stress, per pediatric nursing standards. 79. What is the best action for a nurse when a 12-year-old child with a concussion reports headache? Answer: administer prescribed analgesics and ensure rest. Rationale: headaches are common post-concussion, requiring pain relief and rest, per AAP concussion guidelines. 80. What should the nurse do when a 4-month-old infant has a weak suck during feeding? Answer: assess for neurological issues and refer to a specialist. Rationale: weak suck may indicate neurological problems, requiring evaluation, per AAP feeding guidelines.